Hi everybody, I'm Carmen Hunter with Carmen Hunter Health, and today I'm going to be covering just a brief introduction to Thyroid 101, the beginner's guide to understanding the thyroid. For those of you who missed the call last week where we did about an hour and a half Q&A and just went over the guide a little bit at a time, and I touched on some key points. This is an introduction to what the class is going to be like. The first class is September the 15th, and I will provide a link and some more information along with this video. You'll see that in the notes, and wherever I post this, I will provide a link for signing up. And you can always contact me if you have any questions about what the class is going to entail and what comes with the class. And I will just kind of give you a heads up that you do get a copy of this guide that we're going over today. It'll be downloaded directly to you. You get all of the resources that are in it. Anytime that I update the guide and you see that I have updated, which I do announce, then you get another copy of the update for free. You also get a copy of a thyroid-focused intake document that you can put your own logo on for your clients to use with your clients. It covers really a lot of information and getting a history on a client that may have thyroid disease. You also get a copy of a doctor's template, which is a way for your client to put their history on paper and take to their doctor. It helps them to get organized, and it's kind of just a way for them to feel like they are more empowered when they go into their doctor's appointment, and you get to put your logo on that as well. You also get a month-long access, which I'm kind of tossing around the idea of leaving it open indefinitely, depending on how we do in future classes and how much time it actually takes to interact. But I will be on there every day answering any questions that you have for a month after the class actually ends. So if your questions don't get answered during the actual class, then you can contact me on Facebook, ask me anything that you want. And I'm on there all day. I'm very available and resourceful, and I'm very efficient with my answers, and I'll make sure to guide you in the right direction. And that will include if you have a client that has thyroid disease that you want help with and you need some guidance with, you can just ask me, and I'm going to be there to help walk you through it. So along with that, I'm also giving away, with each thyroid class, I'm giving away a 30-minute brainstorm session with me. It can be on anything. It doesn't have to be on thyroid. It can be about your own health or any other issues you may have with coaching. So that comes with every single class that I do. I give someone the opportunity to win 30 minutes of brainstorming with me. So with that said, I'm going to open up the screen share. This is a very informal process of walking through this guide for you. It is Labor Day, and there might be a little bit of background noise since people are home working in their yards and there's kids out playing. So I apologize for that, but I wanted to get this done for those of you that were not able to attend the class. There were some problems with the Zoom account where it did not record the class, and it also did not record another introduction that I did. So now that I think all the glitches are worked out, I'm hoping that this is going to be easy for everybody to see and understand. So let me go ahead and get my glasses on so I can see what I'm doing. And I want to go ahead and open the guide for you guys. And let's see here. Let me do a screen share. And you should probably be seeing a picture of my son on the lawnmower right now. And I'm going to open up the thyroid guide that I just finished updating today. I added some more information today. And let me get the full screen on this for you guys, if it will open. So just be patient, give me one moment. Here we go. Okay, so the beginning of the guide looks like this. Thyroid 101, a beginner's guide to understanding the thyroid. One reason I feel like it's so important that coaches have an intimate understanding with the thyroid is because almost every cell in the body has a receptor for thyroid hormone. A few in the brain do not, and as far as I understand, but when you think about it, all of the cells in our body are requiring this energy to thrive, and when any of those cells don't get the thyroid hormone or the fuel that they need, then that part of the body is going to struggle. And we're going to talk a lot about, what the different symptoms could be and how the body can suffer if the thyroid is slow or we're not getting the hormone that we need. So we start with the basics and we talk about chapter 1, the location of the thyroid and its function. And the reason why this is really important is because I think the very first step to helping a client understand what's going on with their thyroid is to know where it is. And I do show you a couple more images as we go through the guide on where the thyroid is located in the front of the neck, as you can see. in the picture over here. There's a very intimate relationship with this thyroid here and the trachea. And the thyroid gets one of the logos that people use a lot for the thyroid is a butterfly, because as you can see, it sort of is shaped like a butterfly. There are two lobes to the thyroid, the right lobe and the left lobe, and they call it in this image the right thyroid gland and the left thyroid gland. And there is a very thin strip of tissue down the center called the isthmus, and that's how it is attached to the trachea. So anyway, the reason why it's so important is because it plays an essential role in everything that our body needs. Metabolism, growth, maturation of the human body, and it regulates many bodily functions. Many people consider it the master metabolic gland, but master gland, but it is really truly the master metabolic gland. So anyway, so this whole thing, throughout the guide, you're going to find these little blue links throughout, right here and here, as you can see where my little hand's touching. And those are all the resources that come with this guide that take you even further and deeper into all of the things that you need to know or just share with your clients so that they have an understanding of what's going on. So what does it do? What does the thyroid do? The real question is, what does it not do? It controls and determines everything from hair and nail growth to depression, sex drive, our weight, how we feel, our mood, whether our eyebrows grow, whether our hair falls out, you name it, and whether our joints hurt or our bones hurt. It's just, it's really important, and it covers so many pieces of what it means to feel good. So on the left-hand side are what I consider 4 of the top thyroid resources here, especially the one right here. Stop the Thyroid Madness is one of the bigger ones. And Chris Kresser's ebook on thyroid is very, very, very thorough. Of course, you can go to the endocrine web, which is you're going to get a lot of conventional talk there about and the medical side of things with the thyroid. But I prefer to include those kinds of links as well for those of you who really want to geek out on the medical side of things. So thyroid symptoms should always be the driving force in thyroid care. And I've coined this phrase, the paper versus the person syndrome, when the doctors trust labs more than they trust a patient. And many times people are walking out of the doctor's office not being treated because their labs look okay, even if they feel terrible and they're symptomatic. So here we go with where is the thyroid one more time. Notice the intimate connection between the thyroid gland and the trachea. And again, there is that thin strip of tissue called the isthmus that connects it. And so many times when someone's thyroid is inflamed, someone can feel like they can't swallow or they can't breathe because of the swelling in the thyroid, and can be mistaken for panic or anxiety. We talk about the location of the gland in relationship to other important parts of the body. We talk about autoimmunity, and that Graves and Hashimoto's stem from autoimmunity, and why treating the thyroid actually isn't going to fix the problem. So supporting the thyroid is important, but treating the reason why someone's immune system is out of whack and causing these attacks is more important. And every single one of these links is going to lead you deeper into it. And we're going to talk in depth about all of these things. So we talk about autoimmunity. Many times someone has an autoimmune disease such as lupus or Sjögren's syndrome or something like that, and actually their very first sign of autoimmunity was hypothyroidism, but they were never diagnosed with it or tested. So once someone has an autoimmune disease, the chances are very high of getting another one. And we're going to talk a little bit about how people should approach maybe a lifestyle and eating plan for autoimmunity, and what I would suggest on how to approach people with that, so we're not actually telling people what to do. I'm very careful about my wording and how I talk to my clients to make sure that they understand that I'm not telling them how to eat, how to live, or how to do anything, that I'm simply here as a method of education and support, which I think is really important. That we don't, as health coaches, we don't get in trouble with how we talk to our clients and the things that we say and write. We go into Graves' disease, talk about that a little bit and how it's connected somehow and sometimes to the beginning of Hashimoto's, a little bit of history. We really talk a lot about Hashimoto's because as you can see, sadly, 90% or more of people with hypothyroidism are producing antibodies to thyroid tissue, but not everyone's being tested for it. And so I go into a lot of detail about this part of thyroid disease, which is hypothyroidism. We're going to talk about why some doctors don't think testing antibodies is important, and the fact that we can actually have a negative test for antibodies and still have the disease. We talk about doctors and important labs, what labs are typically done when you go to a conventional medical doctor and why they're inadequate. And then the good news about, how we can actually find help through functional medical doctors and naturopaths. And then I provide links here, of course, on how to find doctors for these particular tests and what labs our clients should be getting, what's important and what they are and why they're important and why they're missed many times. So what do we do as health coaches once we receive lab results from a client? I'm going to talk a little bit about how to work with interpreting labs and resources that you can go to and help your client to actually be empowered to do this for themselves. Because the goal, in my opinion, as a health coach, is to always teach and educate our clients so that they don't have to hire a health coach for the rest of their life, that they learn how to do these things on their own. This is empowering them to take control of their health and advocate for themselves, which is the ultimate goal, in my opinion. So a little bit of a test that you can do at home to test your thyroid. And then we go into quite a bit of detail about the masters of mimicry. And I call it the masters of mimicry because having low iron, high estrogen, and adrenal dysfunction can all mimic thyroid symptoms. So while we want to listen to the client about their symptoms and we want the doctor to listen to the patient, having labs is extremely important. And I like to call this a checklist. This is what we do to narrow things down and look at what's going on. So iron is extremely important to the thyroid, and I would say 99% of the time no one's testing it. And we talk about why that is and how it can give us a clue to what else could be going on besides the thyroid disease. Sex hormones and why they play a huge piece of thyroid health. Let me go back. And we're going to talk about this list of labs over here that are very important and how they play into health. We're going to talk a lot about soy, and we're going to talk a little bit about gluten and why those are important to remove from the diet if you have hypothyroidism or autoimmunity in itself, actually. We talk a little bit about the adrenal glands, how we can get unconventional testing and reliable resources to understand these things, as opposed to just getting a blood pull for cortisol, which I think is not an adequate picture of what's going on. We talk about iodine and why I feel very strongly that anyone with hypothyroidism should not just go get iodine and start taking it, because yes, it's one of the most important pieces of thyroid health. The thyroid actually needs it to make these hormones, but it can be dangerous for someone with autoimmunity to take iodine. Many times people aren't told about that. So I help you to find a way to help your client get ready to see the doctor. We're going to go through some tips with that, and we're going to talk about, and I'm going to share with you the actual doctor's form that I'm going to give you and how to provide that for your client and why it's important. We talk about medications. I'm going to go into this in quite a bit of detail. I think it's really important to educate our clients about why Synthroid is not the only option out there. Another thing that I've run across in almost 5 years of coaching people with thyroid disease is that many times they'll tell me, well, let's just wait and we'll set up our appointment after my lab results come in. And that's just a big mistake, because there's so much that people can be doing to feel better before their labs actually come back. So I'm going to talk a little bit about that. So inflammation is a huge trigger for thyroid autoimmunity, and one reason that there are many people out there still feeling terrible, but they are taking their thyroid medication and the doctors don't have a clue why. So all they do is go up and down trying to manage the medication, when really not, getting to the bottom of the reason why someone feels bad can actually help balance the medication issues. So we talk about the feedback loop, and I use Chris Kresser quite a bit here in my resources. Most of the time I use him for a lot of things because he's just so reliable. But we're going to walk through this whole thing, how it all works, the feedback loop, etc. We're going to talk about how inflammation suppresses the HPT axis. We're going to talk a little bit about thyroidectomy, cancer, and nodules, and what's the difference between someone who's actually had their thyroid removed and a person who has not. What is the difference in treatment, and also why someone without their thyroid also has to pay attention to what they eat as well. Some people have been told that just because they don't have a thyroid anymore, they don't have to worry about gluten and how it affects their thyroid, but that's just not true. So what do we do, and how do we get optimal health when we have thyroid disease. We're going to talk about all of those things. So section 1, we're going to talk about food, leaky gut, and the thyroid, and how sometimes giving those foods up aren't enough. So we're going to cover cross-reactive foods. We're talking about reducing stress and how it's not enough to just manage it, that you actually have to reduce it. And I provide you quite a bit of resources here on helping clients get a handle on those things. We're going to cover tips for reducing stress. I've created my own list here based on experience with myself and clients. I like to go into quite a bit of detail also about exercise, because many times people who have hypothyroidism are having problems losing weight, and they tend to go out and just exercise more and more, and that could actually be causing them to gain weight and cause their thyroid to slow down even more. So I'm going to cover quite a bit of information on that. So let's just pretend we've gone through the checklist of iron and iodine and estrogen and adrenals and thyroid, and our client still feels bad. They're doing everything right, and they still feel awful. There is a list of things that could be going on. And so we're going to talk about those. We're going to talk about the resources for them, testing them. And then I'm just going to give you guys a little bit of information about kind of what I do and how I can help hack at some of these issues on that Facebook group that we're going to have open, where you could be working with someone and they could be doing everything right. And I'm going to be able to help you walk through what's the next step with these people. So let me just touch on one reason why I feel like it is just so important that as health coaches, we understand the thyroid, because anytime anyone is struggling with a chronic condition, a weight loss plateau, or other issues, the very first thing I ask them is, have you had your thyroid checked? Because as I mentioned, it's the master metabolic regulator. And so it's one of the very first signs that something's wrong with us. The thyroid actually steps in there and tries to help us to slow down and to repair and to rest. And if we don't listen, then it really pays the price. And I actually say that the thyroid is a victim of everything else that's going on in our body and in our lives. So as health coaches, when someone's having problems or at the beginning of a health journey and they are struggling with some symptoms, but they're not quite in a state of disease yet, the thyroid is in the background just waiting to step in there and slow them down. And we are going to be able to, and we are able to as coaches, step in and guide them and educate them on how to prevent that from happening. So let me scroll up here one more time. I just want to make a point that if you don't have a disclaimer and a contract set up and you're working with clients, it's really, really important to get that set up. I actually have a coaching program that I have created, a method of coaching that takes you through the steps from the first consult all the way to the very end of your relationship, and it includes all of these things. So that's a totally separate program than the thyroid program. And then there's also an attorney out there called Lisa Fraley, and she is a health coach's attorney that can actually help you to look over your documents and make sure that you're in line with everything. I actually had my documents looked over by a local attorney here a couple of years ago, and I think it's very thorough. So I'm very clear about letting somebody know that I am not a licensed practitioner, physician, dietitian, nutritionist, etc. And I am not here to treat you or diagnose you, prevent, cure, or anything like that when it comes to your health. So we need to be really clear about our guidelines and stay within those guidelines professionally as coaches. So make sure you're all set up with that. And I also provide you with a lot more resources here too. And remember, anytime that you click on a resource, it takes you even deeper. And there's a few glossary terms there as well. So I'm going to go back to, I'm going to stop the screen. Actually, let me see if I can pull up one of these documents and show to you guys what you have to look forward to if you take the class in September. Let's see here. And I think it's under this one here. Maybe it's under that one. Yeah. Okay. So a thyroid intake form is going to look something like this. And this is what you guys will get a copy of. So if you'll notice here, this is really short compared to my normal intake form, which is over 10 pages long. I'm really thorough about making sure I get those high volume questions and answered at the front end. Let's see here. So we're going through and we're looking at about, I would say 18 questions here, give or take, with a few additions, and it covers everything. What are they eating? What's their medication like? How long have they had this disease? Is there a familial trait? So that's one document you guys will get a copy of. And then let's see. The other one was being updated and I don't think it's completed. So let me take a look and see if I can find it. So I'll show you the one that's not, here it is. This one's not completely updated yet, but this is also what you're going to get a copy of. And this is up here. Obviously, you take my logo out, put your logo in, and these are the labs that someone should go to the doctor and ask for. I'm going to give you the whole list. You don't even have to try to remember it. It's all going to be in there. You're going to give that to your client, and they're going to go to their doctor and they're going to ask for the labs that they need to get, the help that they need. So it also, they get to put their story down, which I think is really important, that a lot of people are not telling their story to their doctor. They're getting 15 minutes and they leave out of there and they're like, oh, I forgot to tell them I was taking this, or I forgot to tell them that I was doing this, or I was having problems sleeping. So this puts it all in perspective. It's all in one place. They can give it to the nurse when they get to the doctor, or mail it ahead of time, or fax it, or whatever. These two questions or statements at the bottom are really important. I feel like sometimes the doctor is setting the tone for the appointment, and this gives the client the way to say, you know what, this appointment is for me. These are my goals for my visit with you, and these are my goals for my long-term health. And I've actually noticed that, and I'm going to keep going here, treatments, they can write down the treatments that have been tested or they've tried in the past and what the results were. Because speaking from experience, many times I'd go to the doctor and they'd spend 5 minutes of my appointment asking me, well, have you tried this, and have you done this, and have you tried this, and have you done this? And the whole time I'm sitting there going, oh my gosh, I've done all that. That's where this doctor's form actually came from, and why I created it was to save time, and because I actually get really frustrated and tired when I was trying to find out what was going on with me. I was tired of explaining myself. So this is really powerful, that all the client or the patient has to do is say, everything is in that document right there, and they have a copy and the doctor has a copy, and they go through it together. It's been really powerful. I think that's it. Okay. To help people feel empowered when they walk in and confident about their appointment. So those are the two documents that you get. And this is actually, I'm going to be doing a call on this too. These are the documents that I include in my health coaching program, where you get all of these documents right here to put your logo on and use, except for a couple of the recommendations and examples. So let me close that down. And I'm going to stop the screen share, and I'm just going to go right back to myself. So that's basically the gist of the guide. It's about 40 to 43 pages. It seems like it gets longer as time goes on, because I'm always updating, I'm always adding to it. I do try to stay on top of the most reliable resources and information. And if there are ever broken links and someone sends me a message, I automatically go in and find out what's going on and send an updated guide out to whoever lets me know that that's happening. I'm very available. If you read my testimonials, you'll see that I am Johnny on the spot when it comes to answering the questions and helping people. I feel like it's very important. I'm very passionate about getting the word out and helping other coaches become more skilled at helping these clients. So that's about it. If there are any questions about the class, or you just want to make sure that it's something that you're going to benefit from, feel free to email me at carmenhunterhealth@gmail.com. Of course, you can always contact me on Facebook. You know where to find me there. And to purchase the class, you go to carmenhunterhealth.com, and there is an Eventbrite link up on the right-hand side, and you'll just choose the thyroid class there. And I will be providing the call-in information invitation. It's going to be a meeting just like this, where we talk to each other, we share, we raise hands. You guys get to see the guide as I walk you through it. And then I'm also going to give you the copy of the guide before that as well. I just want to make sure everything's working. Every time I do a class, I do a run through the guide. I check the resources, I check the links, and I make sure that we're on task. That doesn't mean that there's not some glitches sometimes, as we're working with the internet here. But I do my best to make sure that it's a smooth sailing thing. It's very informal, laid back class. And I want everybody to feel comfortable to ask anything they need. And of course, you can ask anything about your own health. So if you're struggling with thyroid disease, this is an open opportunity for you as well. So I hope to see, it's a smaller class. I only like to do about 25 people, so that we have time for interaction and everyone's questions get answered. So there is an early bird price up, usually the first week and a half that I set a class. So hop on there now and get the early bird price. And I look forward to seeing everybody there. So have a great rest of the Labor Day day today, and a good rest of the work week. Thanks, everyone.